Hey, nurses. How are you guys doing? It is great to be back with you all again. As you know, we're still talking about nurse burnout, what we need to do to create those boundaries and to live the life as nurses we were created to live. So I'll just start by saying if you're watching this video, chances are you already know something's not right. You just may not have the words for it yet, but you feel it. Maybe you're exhausted no matter how much sleep you get. Maybe you're irritable. You feel disconnected. You're questioning whether nursing was ever really for you. I want you to know, and I want to say this clearly so that you really truly understand this. Burnout does not mean you're weak. Burnout itself is not a personal failure, and it's often because of long-term exposure to certain environments. And these environments, they require more than they're able to restore for us. And before we kind of jump into this series that's coming up, I want us now, the series itself is going to be focused on healing, on rebuilding. Um, but I do understand that we have to pause. We have to get to that place where we're ready for that. So, burnout itself, especially burnout in nursing, it doesn't always show up as you crying. Um, Sometimes it shows up with you feeling numb, um, not having the words for certain emotions. You feel like you're going through the motions, but you feel disconnected. Have you ever had that feeling where you dreaded your shift, even on your days off? You know you didn't have to work until Friday, but here it is Wednesday, and you already have the knots in your stomach just thinking about preparing, knowing that you have to go in for that next shift. Feeling guilty for needing rest. When you find you become less patient and snappy with your coworkers, with patients, with people you love. Burnout itself is very sneaky. It kind of creeps in slowly, especially when you're someone who's used to just pushing through. And I know that resonates with a lot of you. Now, many nurses don't realize they're burned out because burnout itself is often mistaken for strength. We're praised for being resilient. We often are rewarded for the sacrifices we make. But resilience without recovery will eventually lead to depletion. And that's just the truth of it. So not all burnout is the same. And it's important to understand this before we move forward. With emotional burnout, and there are several types of burnout. With emotional burnout, you feel drained. You feel like your emotional tank itself is empty. You feel like you may care deeply, but you don't have the energy to show it the way you used to. So, for people on the outside looking in, it looks like you're indifferent. It looks like you're cold and you're callous. It looks like you don't really care. You can hear about something that before you felt this way would have tugged at the heartstrings, or someone on the outside, it brings them to tears, and you're like, okay. And other people look at you and be like, how can you just act like that isn't something? But when you're dealing with this day after day and your emotions are constantly involved in what you do for a living, I mean, you can't tell a nurse not to care about the patients they take care of. Impossible. Sometimes, no matter how much you may try to separate yourself from those emotions, you're human. And it's understandable that they're going to creep back in because, again, we're human. This is what happens. So you have to know that even with caring deeply, there's a way in which we can create the boundaries and the safe spaces we need so that we don't experience that emotional burnout. Another is physical burnout, chronic fatigue, body aches. You find that you can sleep. Sometimes you'll sleep all day off. When you finally have a day off, you find yourself sleeping the entire day. And then, even when you get up from that sleep and that rest, you still don't feel rested. You don't feel restored. And it's like our bodies, bless these bodies of ours, they have been very good to us. We have to admit that we've pushed our bodies and taken ourselves places physically, pushed ourselves physically, where our bodies have compensated for the decisions we've made. Have they always been good decisions? No, but our bodies have compensated for that. And I've got to say, I have to be very thankful for my body. But I will tell you this, as you start to get older, your body begins to send you these signals and these flags that, hey, I need you to take it easy. I need you to rest here. I need you to pause. And unfortunately, when we don't take heed and hear what our body is trying to tell us, our body has a way of taking a rest on its own. I would much rather that we are in charge of the rests that our body takes and needs, more than our body deciding that it cannot count on us to do the right thing. When you think of another type of burnout, it's this moral burnout. It has to do with our ethics and our moral compass. And this one always, I'll say usually, hits nurses really hard. It's because there's this pain of knowing the right thing to do, but being unable to do it because of staffing, because of policies, because of systems and the way things are set up. It causes this inner turmoil. And sometimes it's very hard to come to terms with what it is you're doing because you really want to give more, to do more, to be more. But these constraints don't allow you to do so. And if you don't think that it's not taking a toll, you are sadly mistaken. It's taking a toll on you. It just is. And another type of burnout we have to think about is identity burnout. This is when you start to question who you are outside of nursing. Have you really just thought about that sometimes? Who were you? What did you do? And I spoke about this in a previous video, but who are you outside of the hospital? Who are you outside of the facility? Who are you once you take your scrubs off? Who are you when you're no longer taking care of patients? So you start questioning who you are outside of nursing, or even worse, you start feeling like nursing has taken so much from you that you don't even recognize yourself anymore. And that can be a disappointing place to be, because I am sure that before nursing became all encompassing and all consuming, you remembered who you were. You were the life of the party. You got out, you did things. You may have worked hard, but you played hard. You took time for yourself. You knew what that needed to look like for you. And I understand, because sometimes nursing can be a thankless job. But with these burnouts that I've mentioned, the emotional burnout, the physical burnout, the identity burnout, the moral burnout, and ethical burnout, you can experience more than one at the same time. Child, you can experience all of them at the same time. But it doesn't make you broken, it makes you human. And this is what we have to remember, that we have to be gracious to ourselves. I think that we do not extend enough grace to each other. We don't extend enough grace to ourselves. We push through, we push through, we push through, and we aren't often kind to ourselves. We don't talk to ourselves, even our inner voice. Have you ever heard how you speak to yourself? Do you approach and speak to yourself with kindness? Not always. And for some, not often or not ever. So I want to be really clear about something. This video in this phase of where you are is not about fixing you. Way too often, nurses are told, just practice self-care. Or, when you went into nursing, you knew what you signed up for. And again, that you should be grateful for what it is you have, especially if you've ever come from a religious place or a religious perspective. We as nurses sometimes can live very good lives, very nice lives when you look at it from the outside in terms of materialistic things, even the opportunities we have to help heal. But it doesn't take away from the fact that when our bodies and when we need to rest and when we feel burnt out, that's just where we are. And we shouldn't have to apologize for feeling that way. When you say these things to yourself, when you hear these things, and when you tell yourself these things, it actually deepens that burnout. So before we move forward in the series, we need awareness. We really need to be honest with ourselves and honest with each other. And you cannot heal what you refuse to name. So we have to be honest about where we are and how we are to ourselves. So right now, your only job is for you to notice where you feel tired, where you feel resentful. That's a big thing. Feeling resentful. And before you know it, if you're not careful, it will take you to a deep, dark place that you just don't want to be. And sometimes it can take a lot to pull yourself out from that place. Also, I want you to think about where you feel disconnected. Again, this is a judgment-free zone, judgment-free place and space. We are here to uplift each other. We're here to encourage each other. We're here to move forward. We're not necessarily looking at the mistakes and things of the past because you know what? That's the past. That's why our rear view mirrors are as small as they are because you're not supposed to spend more time looking behind you and looking at your past than you're supposed to be looking out of that large windshield that's in front of us. So, again, this isn't for judgment, this isn't for guilt, but I want to offer you a very simple reflection. And you can honestly pause the video if you need to at this point. But I want you to ask yourself, what part of nursing drains you the most right now? What part of myself feels the most neglected? And you can ask yourself, if nothing changed, how would I feel 6 months from now? And these questions aren't meant to scare you, they're meant to ground you. So if you feel this video resonated with you, I want you to know something. Know that you're not behind, know that you're not failing, you're becoming more aware. And that's where your power lies. It lies in your awareness. So before you click out of this video, I want to invite you to do something that helps this channel reach more nurses who are struggling quietly, just like you may have been. I know it's where I was. So if anything in this video resonated with you, please just take a moment to like the video. It tells YouTube that this content is worth sharing with other nurses who need support. Again, we can't just support our patients, we have to support each other. So I also want to hear from you in the comments. Answer this question for me. Which type of burnout are you experiencing the most right now? Is it emotional? Is it physical? Is it moral? Or is it identity burnout? And you don't have to explain it, but I will say, even one word helps, and it reminds other nurses that they're not alone. Again, we are a community. We are here to help each other. And if you're new here, please subscribe to the channel. I will be doing this every day. And this space, this channel is dedicated to honest conversations about nursing, about burnout, and about learning how to stay in this amazing profession without losing ourselves. So, over the next few videos, we'll be preparing and we're going to see together this focus on burnout recovery. And you don't want to miss the next step. So, if you know another nurse who's been carrying too much lately, please share this video with them. As you know, sometimes encouragement doesn't always come from words, it comes from being seen. And sometimes you don't always have to do the pouring, but just show someone where they themselves can be poured into. And that's what I'm here to do. So thank you for being a part of this community. And please understand and know that what you're feeling, it matters here. And that this is and always will be a safe space. So until next time, guys, take care.